This is the Corrections Forward podcast from the American Correctional Association. Here's your host.
Good day, and thank you all very much for joining us for another episode of our podcast. Today is a really special podcast where we have the opportunity to really talk about National Nurses Week, but more importantly, the people that do the work in this really, I think, specialized field, work in the field of corrections that is so important to the care and treatment of those within our custody. So first and foremost, I want to welcome to today's show Dr. Marielle Marlowe, who's the Director of Correctional Health here with the American Correctional Association. We have Tammy Smith, who comes to us from the great state of Kansas and is going to tell us a little bit about her work there, and Kevin Runyon, who works within the Ohio Department of Rehabilitation and Corrections. And we're just going to have a conversation about this work and the incredible people that do it. But first and foremost, for our listeners, this is a month of commemoration across the field of corrections. We have Correctional Employees Week that's starting this Saturday. And so, we're celebrating every discipline as we can that makes this work move forward. And you cannot have a discussion about professional corrections in this day, this age, with the number of individuals that we are dealing with inside our system, the acuity of the population, and the care that we provide, without recognition of the 30,000 plus nurses, and that's RNs, LPNs, and those with advanced specialized practitioners that work in this field. Ladies and gentlemen, let that set in. 30,000 correctional practitioners, professionals working in the nurses field. So really quick, the history of National Nurses Week. Know how it began. We start May 6th with National Nurses Day. That's the first day of this celebratory week from the 6th to the 12th. That's National Nurses Day, kicking off National Nurses Week. I don't think, or perhaps many would not know, that we end on the birth date of Florence Nightingale, the founder of modern nursing. And I think that is a real fitting tribute. National Nurses Day and National Nurses Week had many iterations, really starting back to 1953. All right, so this is not new, where those that worked in this field and the greater profession external to corrections noted that these were special people doing incredible work inside this field. So from 1953 through the 70s, 1974, all the way up to the 1990s specifically, where the American Nurses Association really promulgated and was involved in bringing forth National Nurses Week. And in 1993, it was solidified with this May 6th to May 12th and became, if you will, the permanent dates for us to celebrate this incredible discipline. So as we move into National Correctional Employees Week, we're going to spend some time talking specifically about those that do this work. I'd like to now first give our guests an opportunity to introduce themselves. So I'll start with Dr. Marlowe. Introduce herself and come around to each one of you and talk a little bit about what you're doing in this field and what's your connection. Dr. Marlowe.
Well, thanks so much, Mr. Green. Excited to be here and excited to be joined by our guests, Tammy and Kevin. It is great to be talking on this topic because we all know that nurses in correctional healthcare are the heart of correctional healthcare. So for me, my background, as Rob already mentioned, I'm the director of the Office of Correctional Health here at ACA, and my role centers on connecting, supporting, and elevating correctional health professionals and their voices, and creating spaces for conversations like this one about what's working and where we need to go next. A little bit about myself. Prior to this role, I was in federal service for over a decade as correctional health coordinator at the Centers for Disease Control and Prevention, ensuring that corrections had a spot at the table in national health conversations like this one. And I would say whenever I would deploy to the field to correctional facilities, it was always directly working with nurses in the facilities who were just top tier. And what I'll highlight that I always knew about it is, or that I always recognized when I was at these outbreaks in facilities, is that nursing takes a level of empathy that goes above and beyond. Nurses in corrections have a level of empathy that even goes above and beyond and beyond. And I have just never met more empathetic people in my entire life who are both empathetic and practical. They got the job done and they never lost sight of their patients and patient care. So I'll leave it at that because I'm so excited to hear from our two guests.
Very good. Thank you, Dr. Marlowe. Kevin, let's go to you. Please tell us about your work in the state of Ohio. And I feel like when I say Ohio, I need to recognize this tradition of OH and have many people scream IO, because that's kind of how it works anytime you're in a space and you mention Ohio. It's a pretty cool tradition.
Oh, it definitely is. They're pretty proud of our Buckeyes, and most folks will reply with that IO as soon as that OH goes out there. So my name is Kevin Runyon. I'm the Medical Operations Director for ODRC. Prior to that role, I started off as a line nurse myself at a facility where I would see our patients, and then I moved into our correctional or our chronic care nurse, which we're going to probably talk a lot more later how important that is, and then moved over to our state health department where I was the prison and jail liaison with public health and correctional facilities, which as Mario can tell you is important. And then came back to work at our central office at the operations support center level and moved in eventually to medical operations position where my team assists our facilities and following our policies and protocols, making sure they have the resources to do their job and to, be on site to make sure that we're doing our job appropriately. So a lot of it's resourcing our staff to get things done. And it's an opportunity to work with over 650 of the best nurses in the entire world. So we're very proud of our team.
Thank you so much, Kevin. Tammy Smith. So you're the chair of our nursing committee and have been for a bit, and just so much appreciate your work, both of you, and your work in support of the American Correctional Association. Tell us about your work and your tenure in the great state of Kansas.
Thank you, Mr. Green, for that. And for my also conspirators in crime, Kevin Runyon and Dr. Marlowe. What I do, I couldn't do without the support of ACA and with my co-chairs. So thank you, first of all, there. My name is Tammy Smith. I am a nurse administrator for Kansas Department of Corrections, Office of Healthcare Compliance. So part of what I do is I oversee infection control, the pharmacy, and delivery of care of interstate compact patients. We also assist with developing and creating and implementing policy and procedure, and ensure that the medical vendor for the state of Kansas is delivering care. And I will have to disagree with Kevin. I think we have the best nurses in the state of Kansas. We have a dedicated staff, and it's awesome to work with. I really enjoy what I do and being able to provide patient care and affect lives of those that are entrusted in our care and custody. I initially started as a staff nurse, then promoted as a site infection control nurse. Then I was asked to serve as a health service administrator. From there, I moved up the ranks as the regional infection control nurse for the state of Kansas and moved from that position to the Office of Healthcare Compliance. My prior life, I was a research oncology nurse. So a huge jump from one population to another. love what I do. I love serving the patients and serving alongside the dedicated professionals that we have, that we've partnered with at ACA. Our collaboration and relationship that we have with other facilities is phenomenal.
Well, thank you. And I'm sure if we ask the remainder of our state colleagues, they would all say the same thing, that they have the best nurses, as they absolutely should. So maybe all three of you do know a bit of my history. I've been in corrections for 41 years, 39 in the field at the local level, and then as the Secretary of Public Safety in Maryland. And from that end, I have just always been absolutely amazed by the work of this particular discipline. Not just amazed, but the importance of it and the depth of the work and what a day looks like. So as a correctional officer, that's where I started, 1984. The nurses, we worked as an officer, as a correctional, all the way through all the rank structure. I mean, the nurses were our lifeblood connection to the population. Our ability, for those, many of which are watching this podcast, work in this field, but there are many that don't nor understand the appreciation and the connection between every line level staff member and the nurses that provide this incredible depth of care. So, when I think about the depth of care, I think about everything from a medication pass that in some instances takes hours throughout a corrections facility to complete, to a chronic care clinic. All of that working around, as they say, when the deuces are called, when someone says we have an emergency, and these nurses dropping everything they do, responding side by side with correctional staff to an incident that may involve self-harm, harm to another, an individual in an emergency situation, in medical distress. And in my facilities, seeing that happen multiple times in a day, that right along, hand in hand with correctional staff, these are lifesavers. These are individuals maintaining human life at a moment's call. Tell me about, and I'll start with you, Kevin, come back to you. Is there such a thing as a normal day in correctional environment as it applies to a nurse?
I think some of the things you'll hear everybody say is that you've never seen everything. You can never say that, or that if you're expecting that to happen, it's not going to happen. There's going to be something that comes up. You could start out with your plan for your day, but it's going to be broken up multiple times by, like you said, emergency calls, things that'll just pop up out of nowhere that you're not expecting, different type of disease processes that you would expect to see in a correctional environment. So no, there isn't a normal day. And that's part of although that's hectic and that's stressful, but that's part of the wonderful things about being a correctional nurse, is that there is an environment, a charged environment, where you have the opportunity to do some amazing things, unlike any other nurse that you're going to find in any other profession in the United States.
How about you, Tammy?
Just like Kevin just said, we plan our day, we start, and then we prioritize. We have medical emergencies. We may have altered mental status. We may have a fight. We're an emergency room. We become first line care for patients who are in distress. But then our day may be, we try not to say the Q word, quiet, because when we say that, then everything happens.
Touche.
During those times, we start out with sick call first thing in the morning, and we're seeing generalized patient complaints that we're having to come in. We're triaging those, but it starts with our collaboration and what we're doing with the patients, working with the officers, the correctional staff. It takes a village to raise children. It takes a village to operate a correctional facility and run effectively within our system.
Thank you, Tammy. And Dr. Marlowe, I think, in understanding your history, when you're called to the scene, there's nothing normal about the moment or the day and what you did, correct?
Yeah. And, you remind me of went out for a mumps outbreak in a facility. And we get there, and of course, we're public health, and we're ready to tell them, everything they need to do with that, and discussing with, the medical staff there. And I remember the regional nurse looked at me and she said, "You decide. We can either vaccinate everybody, or we can do med pass and get them their diabetes medication and all the specialized chronic care medication." Because like you said, having to prioritize across that day and the challenges and staffing challenges as well. Always something, coming up that you all are just ready to be there. But she was being practical about it, and she was always very, very kind and direct about what needs to get done. And you could see the levels, the levers working in her mind of what needs to be moved around and how we can work with security to get it done.
All right. Yeah. There's nothing normal about a day. And as Tammy tells us, stay away from the Q word. So Tammy, you said something that in these podcasts, while I have a couple of structured questions, I tend not to use a third of them because the conversation leads me elsewhere. And the longevity of my career in 39 years, if nothing else, I have the time to look back of the way things were in this field since I began in 1984. And so I think about when, as an administrator, we first started reaching out to local universities and teaching schools to say, is there a place for internships inside our systems? And once we got through the conversation of that, and perhaps there were maybe not, and we're able to advance that, the things that I heard that were absolutely amazing is that nurses, student nurses, entrants coming into the field, that what they were able to experience in a week in corrections, they may have not seen in a year of practice in the community. Do you think that holds true, Tammy, even today?
Thank you for that comment. I think it is very true. The diverse care that we deliver, and if you work at a jail and you have male and female population, that changes the field then dramatically. You may be delivering a baby that was unexpected. It's the diversity of the care that we deliver is so awesome. When I was training nurses to come into the field and orientating them, I tell them everything that you've learned in nursing school and then some, you will use in our facility. Everything is different, and you think you know how to deal with a problem, and you have a surprise. Probably the most heart-stopping call is when I get a call at midnight or close to it from a state representative or the local health department telling me, I've just talked with the governor and I assured her that you would move a patient from one end of the state to the other within 24 hours and get the patient in an isolated area and to the specialty care. Absolutely, I can do that. But it's just a challenging field, but it's an exciting field because you do employ all of your skills and the vast knowledge of your staff. It's amazing how during an emergency, people come together, and it's just like a well-oiled clock.
Well, and you bring up you bring up a very good point around, and I'm glad you said it, that our colleagues in the jails, in pretrial environments, that intake assessment and diagnostic process is extremely complicated. I won't put one over the other, but it is a different type of work. Watching the speed at which and for those that don't know, at every intake in America's jails, central booking, in an intake assessment the nurse is side by side with the correctional staff member doing that intake, doing that diagnostic from street into facility. And that is an absolute standard of the American Correctional Association and how we apply that. Kevin, coming to you, what I've always admired in the state of Ohio is this incredibly strong relationship with OSU. And while I'm probably in the back of my mind know the answer to this question, but are you particularly in the field of nursing and healthcare? Do you have a relationship with OSU in that space? Seems like you do in everything else.
We do, actually. They are our specialty providers. So, and our relationship with OSU is there's something that we need to have that we cannot provide inside of our facilities, which we can provide quite a bit. We have our own long-term care facilities. We've got our own acute care center. We do dialysis inside our facilities. We have our pregnant females. We even have a nursery that keeps some younger children in there for a period of time. But when it comes to when we need the specialist and emergency care, we have our partner, Ohio State, and it's a partnership that's been together for over 25 years, where we can send them there. We actually have our own hall there where our patients are kept in a secure wing, and we're able to take them there, and helps obviously with the custody aspect of that, having somebody outside the wire. And then also those specialists understand our needs and how to work with us. But anytime that, like I said, our providers say, hey, this person needs a higher echelon of care, we send them to Ohio State. They're able to do whatever diagnostically, perform surgery. And then after that point, they can step them back down to us, to our acute care center, and then we can put them back in the general population. So it's a relationship we've had for many years, and we'll continue to have for many more. And it's been very successful for, I believe, both of us.
And I think the general population, again, general. Here's my statement about when we often in the field of corrections say that people don't know what we do, and or I've had people say there may be a general lack of appreciation in the general populace about what we do. My counter statement to that is, and what I'm learning by getting into the field, and whether it's our colleagues on Capitol Hill, local political circles, is that we haven't told them. We haven't showed them. That onus is on us. Absolutely. To tell this incredible story. Hence, part of this. It's really the passion that brought me from working in corrections, and I am by no means retired in any stretch of the imagination, but it is this passion to tell our story. And both of you see it in everything that we do at the American Correctional Association. The story of us is a really important piece. It's an important piece of recruitment. It's an important piece of care, but it's an important piece for everyone to know, to include the families of those that have experienced incarceration, and know that we are doing really good work in this space. And Dr. Marlowe, you've brought us 2 home runs here. I want you to start thinking about what you're going to tell us about what's upcoming in Pittsburgh and other places around this, but around what you're preparing for this field. But I got one more question for both of you. And again, we're trying to keep this to 30 minutes, but I have a sense we're going to blow that out of the water. One of the things that I've really seen happening is the evolution of the position, especially around those with serious and persistent mental illness. In my time in corrections, I've just seen this continue to multiply. And listen, there is no debating the fact that deinstitutionalization in the United States in the 70s resulted in America's jails and prisons to some degree becoming de facto areas of mental health and behavioral health care. But that being said, it seems to me that every day we're asking our nurses to be almost as much a mental health care practitioner as we are a clinician in other spaces. And I'd really like to get your reaction to that. And starting with you, Tammy, please.
It has become an evolution. Initially,
Mhm.
when I started in corrections, we only had behavioral health staff Monday through Friday, 8
Mhm.
to 5.
Mhm.
And it was nursing after on weekends, holidays. And now, even though that we have mental health staff on site for a much longer period of time, it's still nursing is the key. We see the patients daily. Behavioral health has such a huge caseload. It's difficult to get around to all of the patients. I have gone in a restricted housing cell, sat my self beside the resident and said, okay, what's going on? What's happening? What is going on? Whereas in the hospitals, any behavioral health or any mental health was kind of pushed aside. In corrections, we're all a part of the behavioral health care, and we're having more and more behavioral health patients coming in. We are the de facto mental health facilities for our communities. With the decrease of places for behavioral health people to seek inpatient care, it's becoming less and less, and it's very difficult at times. It's trying.
Complicated.
We had a lady when I worked at a local jail who was released in less than 24 hours, committed suicide.
Those are the very sad outcomes and cases but again, I see us so importantly really being part of those solutions and doing a good job to connect folks better than perhaps we did in the past.
Yes, our discharge or release planners actually, they involve myself when we have a difficult behavioral health plan, somebody that we need to have intense services upon release. We have a collaborative team that gets together, and we all start making housing arrangements, and it's an MDT meeting. With providers, with psychiatrists, behavioral health, discharge planners, and we even include parole, because we have to think past the incarcerated setting.
Mhm.
These residents are going out into the community, and we need to involve the community aspect sooner than later. So that
Absolutely.
collaboration.
And for those of our colleagues that didn't catch the multidisciplinary approach, we always try to make sure folks know that acronym when we're talking about it. So, Kevin, tell me about your thoughts on this evolution of having to, quite frankly, carry two hats.
So, in Ohio, we're fortunate we have our behavioral health team, which has nurses that are assigned it as well. And they'll be in our residential treatment units. And a lot of times our nurses had that first contact with that patient, either the ones that they may come to medical in some sort of crises, get the referral over to our mental health providers to be seen. But it's that recognition of this, what can we do to step them down or to help control the crisis until it can be treated or seen by a provider. The beautiful thing about the nurse licensure is that it allows us to work in different areas and different specialties. And we utilize it to the full ability here in the state of Ohio, just with how we utilize those nurses. And then we know that the challenges across the country right now to find mental health providers are out there. And once again, the licensure of the nurse allows them to get some more training and education to be able to provide some of these mental health services that they can't find out in the community. So although it's a challenge, it is an opportunity for some folks that may have never had the opportunity to have treatment before to be started on some form of treatment and then be released, hopefully under control of their mental illness and maybe not to commit another crime to come back. So it's an opportunity, to say the least, to both bring somebody, both mind and body, prepared to go to the community. And that's hopefully what we're doing. So,
Kevin, I love the way you said it. And I think you're just spot on. It is a challenge, but it is an opportunity, because for some, and I don't think either of you will disagree, this is their first opportunity at engaging
absolutely,
behavioral health and mental health care, and a connection, right? I mean, we have become that at in some aspects at the worst point in their life, that they have either committed a crime, facing prosecution, and or are in our prisons, but it's creating this opportunity, because I've had so many families call me, and always wanted to make sure I was accessible to the families, especially around healthcare issues, but would say, listen, that is not where I want my son to be, but while he's there, can you help in this space? And then the second call, thank you for helping in this space. So those were always just really meaningful moments for me as an administrator, as a warden, as a director, to be able to, in a time of a really difficult time, to seize the opportunity to get people on a different path. As we begin to wrap this up, Dr. Marlowe, tell us what you have in store for us as members of the American Correctional Association and those that are practicing in this space, perhaps in the coming months, and as you know, something I know you've been working very hard on, which is the itinerary and agenda for our 156th Congress of Correction in Pittsburgh, Pennsylvania, later this summer.
Of course. And I just want to give us the tagline for the conversation we were just having. Correctional health is community health.
Mm-hmm.
So, just always, that's the sort of my mantra that I always put out there when we're having these conversations. Going back to what you're just mentioning, Rob. So coming up for the field, here's what we got for you. First, keep an eye out during National Nurses Week. ACA on our social media platform is going to be highlighting several exceptional correctional nurses who were nominated by their colleagues each day. So keep an eye out for that. And also during National Nurses Week, we're going to have a discount membership for nurses. And always keep in mind that nursing students membership's just $10. So just want to put that out there as the first one. The next is, we're very excited. We are moving towards putting our certified correctional nurses and our certified correctional nurse manager certification exams onto a virtual platform with electronic platform for the exam, and then virtual proctoring. So stay tuned. That's coming out soon. We're going to have that rolled out in the coming months. And then let's talk about conference. We have over 30 workshops, clinical workshops. They cover a range of critical topics of the field, many of which we just covered in this podcast: mental health, behavioral health, mental health, substance use disorder, aging population, care of patients with dementia, not just for the health staff, but also for custody staff, how to approach the care of patients with dementia in your facilities. Then we have a special session on AI for correctional health systems efficiency. So we hope that's something that can come and help, never replace nurses, but to help them make their day more efficient and help them with that prioritization that we were talking about, and being able to save some of their time so they can put it back into their day. And, especially addressing issues like mental health concerns in the facility. I want to put out there that we also set a promo out to students, especially in the Pittsburgh area, that for students, at the public health schools, at the nursing schools, the medical schools, it's $50 to attend conference. And the reason I highlight that is it brings up the topic of recruitment and retention.
Mhm.
And the thread here is Tammy is going to be one of our speakers at the conference. You're going to do a session on nursing recruitment and retention. And I wonder, Rob, if we could have just 1 minute for Tammy to give us a teaser on that workshop.
Certainly. Tammy, go right ahead.
We are going to discuss the upcoming shortage with nursing and what we can do to help shortstop that shortage within our facilities. So stay tuned.
Very, very good. Well, thank you. Dr. Marlowe, since we're up against our wrap up, thank you for all of that incredible information. And as we close out, let's just leave everyone with this. You know, when you think about all of the various disciplines that are in this field, and obviously there is the American Correctional Association and many associations, whether it is your national nursing organizations, whatever that is, join it. Listeners, be a part of the conversation. This is not about building any type of kingdom of accommodation for any particular discipline. When you join associations, work groups, professional groups that are coming together for this greater good of your occupation and your field, you're giving of yourself to the next generation, the next individual, and you're creating absolutely a legacy of lasting change in the field. And it is just so important. And this is by no means an infomercial for anyone. While we would love you to be a part of the professional organization that these two individuals help service, the American Correctional Association, get involved in your discipline. Again, we see you, we hear you, and what you bring to the table can absolutely create lasting change for people into the future and into your occupation. So become part of the conversation. Come and join with us. See our 156th Congress of Corrections. Spend time with Tammy. Spend time with Kevin, and building relationships in this work. Nothing replaces the power of presence, the power to gather, to exchange ideas, and support each other. So to all of our guests, I just want to thank you so much for the time that you've given us. And I assure you, we will do this again. We're going to do it again in a big way, starting July 29th in Pittsburgh, Pennsylvania. But thanks for all you do, and happy National Nurses Week to an incredible group of professionals. Have a great day. That's it, Kurt. All right, will you bring us back together?